My name is Bizri. I'm a public health pharmacist. I have a community pharmacy in Beirut area. Lebanon has suffered and still suffering a very severe crisis and conflict problem. And during the war, the major part is the severe shortage of medicines and sustainability of healthcare. We do fear of outbreaks of major problems, and this is why community pharmacists can play a major role in this area where they can serve these communities.
My name is Barbara, and I've worked in various conflict zones. I've worked in Iraq during the liberation of Mosul. I've worked in Ukraine before the escalation of the war and during this phase of the conflict. So the neat thing and interesting thing about pharmacists is that we are technical and medicine experts, but also have a lot of social skills that can be applied. So in conflict zones, it's not only the obvious of disrupted supply chains because a building collapsed or something like that. It's also a lack of access because there is a negotiation that needs to take place or there is information that needs to be shared. So pharmacists are in a unique situation where they can bring the technical expertise, but also at the same time negotiate access and ensure that the supply chain is maintained.
We have to support these displaced people to ensure that their mental health is not worsens because they are coming from area they were under stress, anxious and not happy. They don't know well what they are expecting, what is their future. They don't trust the people that they are in the new area. So the community pharmacists are here to help, to support, and to make them understand that they can be trusted. We help them to have their medications and to trust us that we are going to give them, even if it is a substitute or generics, it is the same branded that they were used to. We have to help them to see where they can go for the primary healthcare centers, where they can have the continuity of their programs such as immunization, vaccination, maternal and child welfare.
So I think the key thing in the fragile context is that access is sometimes lost because of the natural barriers due to a conflict, but also because health is often weaponized and it's seen as a target. This happens in a lot of countries and both humanitarian and government organizations. So the good thing about pharmacists is that we can be that neutral advocate that can bring to light mainly the technical aspects without focusing on all the politics behind them. We are one of the health professionals that's closer to the public, that's always there. Public can come to us, and we can take those demands and advocate on their behalf. And so I think we need to think of ourselves not just as technical experts, but really that advocate and negotiator on behalf of our patients.